I've watched a patient sleep with their eyes wide open. I have seen someone go from wide awake to completely asleep in less than 30 seconds. I've watched sleepwalkers and people who act out their dreams, and I've even seen somebody sleep all night with a ukulele. Yeah, that's true. They had a ukulele that they slept with all night long and every night and brought it with them for their sleep study. So it's probably safe to say that there really isn't anything that I have not seen somebody do in their sleep. Watching people sleep and helping them improve their health by treating their sleep problems is the main focus of my career as a polysomnographic technologist. That's what most people would call a sleep tech. And my name is Kristen Slagle, and I am a registered polysomnographic technologist. I have worked in sleep disorders medicine for about 30 years. I've done sleep studies at night and supervised sleep labs, and I've trained new technologists. A sleep tech is a healthcare professional who records sleep studies. And a sleep study is a diagnostic procedure that doctors use to look for any body changes or activities that can disrupt the patient's sleep. Some of those things can not just disrupt their sleep, but it can really adversely affect their health. So it's important to get those sleep disorders identified and treated. So to understand what a sleep tech really does, it's best to know what's involved in a sleep study. There are actually three main parts to performing a sleep study: the preparation, the all-night recording, and the analysis. First of all, the study preparation is the most important step. The techs call this the hookup because of all the wires and monitors that need to be connected to the patients. If they're not put in the right place, the data could be wrong. If the tech does a sloppy job, they might have to go in and fix things during the night, and that's going to affect the sleep study. So it's like the old computer saying that garbage in equals garbage out. We put on small wires or electrodes, and they need to be glued onto the scalp in certain very specific locations, because different parts of the brain give off different waveforms, so it's important to have those wires in the right places. We put wires near the patient's eyes and chin, and those are really important to pick up the body changes that happen during dream sleep. And the tech will also put on breathing and heart rate monitors. Once all those monitors are in place, they'll do a systems checks to make sure everything is working correctly before the patient goes to sleep. The second aspect for a sleep study is the actual recording. That occurs mainly between about 11 p.m. and ends around 6 a.m. During that time, the patient, or the tech that is, will observe the patient's brain waves and EKG and respiration changes. If the patient stops breathing, that's called sleep apnea. And to fix that, the patient may need to try a breathing treatment called CPAP. The tech will put, well, what kind of looks like an oxygen mask over their nose, and that it forces air into their airway. It blows air into their nose, which keeps their airway open. And once that air pressure gets high enough, it fixes the sleep apnea, and the patient no longer stops breathing at night. So you can imagine how that it can be a little difficult to get used to at first, but you can imagine over time how that can help somebody really sleep a lot better, especially if they've been really having a lot of breathing problems while they sleep. So it can also actually help reverse some diseases like high blood pressure. The third and final part to a sleep study is the analysis of all the recorded data. The sleep analysis tech looks for certain patterns and knows what's normal or abnormal. That's what I do currently, and what I do is I look through each frame of the sleep study to look for any sleep study changes, abnormalities, leg movements, anything that might be affecting the patient's sleep. The computer program tabulates all the data after I've done that, and then it prints a report for the doctor to look at. So in summary, sleep studies can be very interesting. It can be very hard work, but it can be very rewarding work as well. And it definitely is very helpful to the patient. By doing a really good preparation and then a good nighttime recording and finally the study analysis, a sleep tech has a really important part in making sure that the patient is properly diagnosed and treated correctly by their doctor. I think sleep disorders medicine is a really interesting field. Sleep techs are really important because they are directly responsible for obtaining quality information for the doctor to use when treating the patient. Every night is different. There is always something new to learn and observe. There are always interesting things to see, whether it's actual clinical data or just behavioral data. It's also a very rewarding job because lots of times the patients are just coming into the lab, they're just worn out, they feel terrible, and they leave feeling a lot better and really rested. They're so thankful to finally get a good night's sleep, and it feels good to help them with that. And this career is really rewarding and interesting, and it makes a big difference in patients' lives. So I really, truly enjoy it, and I hope you enjoyed learning more about it. Thank you.